Good morning, good evening, everybody. I am Vaidya Ajitkumar Mandlecha. I would like to welcome you all to GCAR Global Webinar Research Series. GCAR, that is Global Council for Ayurveda Research, is an international non-profit organization based off of USA. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No nonprofit can operate and succeed without volunteers. So we would love to have your participation. Please consider joining us as a volunteer, and we can place you in variety of projects based on your skills and also your interest. Once again, our website is www.ayurvedaresearchusa.org. Right, so now let me introduce our eminent speaker today, Vaidya Ajitkumar Mandlecha. Namaste.
Hey.
He is BAMS CPC MPhil. Vaidya Ajitkumar Mandlecha graduated with BAMS Bachelor of Ayurveda Medicine and Surgery from Pune University in 1995 and further specialized in traditional Kerala massage and Panchakarma techniques in 1996. In 1997, he received yogic training under the guidance of Satish Brahmachari and Swami Atmabodh, laying a wonderful foundation for an integrated approach to health and healing. With a strong commitment to evidence-based Ayurveda, he completed an MPhil in Panchakarma therapy in 2009 with a research focus on the efficacy of Kati Basti using Kshirabala Tailam for lower back pain. Currently, Vaidya Ajitkumar Mandlecha practices at clinics in Pune and Vishwananda Kendra and also travels regularly to Europe to teach through the International Academy of Ayurveda and European Ayurveda Academy. His practice is deeply rooted in the classical teachings of Charaka and Ashtangarudaya, while being informed by contemporary Ayurvedic research and also clinical innovations. As a passionate educator, he conducts personalized Ayurveda training at Pune in his clinic for students from Europe, USA, Brazil, and Israel, sharing authentic clinical wisdom through small focused classes. Currently pioneering work in Ayurveda engineering, he is dedicated to integrating objective clinical parameters into Panchakarma protocols, contributing to the evolution of evidence-based Ayurveda. Thank you so much for joining us today. We would love to hear your talk about Lekhan Basti. So let me hand it over to you.
Thank you, Asori ma'am, for this nice introduction. So I will directly start my lecture now. We're not late. So I will share my screen.
Mm-hmm.
Okay, today's I directly start my uh, lecture on Lekhan Basti.
Yeah, sorry,
Lekhan Basti.
we are not able to see your presentation.
Can you see the presentation now?
Yes.
Yes, yes.
Yep.
Very clear.
Yep. Thank you.
Yeah. Okay. Thank you. Uh, so basically, the Lekhana treatment, that what we do in a different form. Actually, today my main topic will be not only Basti. I'm going to talk about the Lekhana of various kinds. Means we do the Lekhan from the external form, then the Basti form, then also from the didactic form. So the various forms that what we use for the Lekhan Basti, that all I'm going to talk today. First of all, the Lekhana means everybody knows that how to do the Karshana. Okay, so if you go to the root meaning of this root word, that it is just to remove, it's like we are removing all the toxins from the body. Second thing, to scrape out the excess fat from the body, and also to scratch whatever the debris are there from the body, and discard the vitiated fractures from the body. This is what the Lekhana means for us. So that's why not only the Lekhan Basti, what we do, so we do the different kinds of various allied treatments as a Lekhana, means for example, Udvartana, that also we include in this pre-Panchakarma procedure, like Purva Karma, also we do the Lekhan kind of things that we use in the therapy. Now, when we look at the Lekhan Basti as a treatment point of view, so what exactly it is doing, that we know that in the Lekhan Basti we are using all the scraping agents. So that is helping us to give the cleansing effect on the Shrotasa, as well as whatever the toxins are there, we are also uh, means for the detoxification purpose, means for the Amapachana purpose also, we are using this various kind of therapy. Means Pachana therapy, for example, if you go to the Vaitaran Basti, just giving the example of this Vaitaran Basti, it is also like Utkleshan and the Pachana Basti, where this Amlika and Gomutra is also used in combination for that. Then Medohar Basti, this Lekhan Basti, which is containing Gomutra and the Triphala like ingredients, there, that's why they are also helping us to get rid of from this excess fat accumulation what has happened into the body. So that's why such a kind of Lekhan Basti is also having this Medohara property, then helps to reduce the Avruttvata. Means when there is some kind of a obstructive phenomena what is happened into the intestinal tract, or when there is a Srota Roda is there. So in that condition also we can use this Lekhan Basti, because if you look at the content point of view in the Lekhan Basti, for example in the Kalka, all these Ushna Tikshna Dravas are also used. Gomutra is also very penetrating and Ushna Tikshna. So that helps to overcome this whatever the obstructive phenomena has happened in that system, so that it can help reduce the Avrutatva. Now the Lekhan Basti, to whom we can use it. Basically, Lekhan Basti in our practice here, mostly we are using in the obesity patient. I'm going to share this obesity patients with the case studies, what we have done here in few case studies that I'm going to share, so that we can see that how this Lekhan Bastis are very useful in this condition. Then Medo Dushti means you can see when we are doing this therapy, we can see the inch losses, means that they are reducing the cellulite from the body. So that means it is also helping to get rid of from the excess fat, which is having the scraping agent property. Mudava, when there is a like a uh, any kind of obstructive phenomena, to take out the obstruction from this intestinal tract, that is also helping to get rid of from this Mudava. Then in Amwat condition, for example, like as I just mentioned about the Vaitaran Basti, which is one of the very good Basti that what we can use as a Lekhan Basti in that Am condition. So the another thing is that when we are considering this kind of Amvata cases like rheumatoid arthritis cases, So when there were multiple joint pains are there, so in the Purva Karma, when we are utilizing this, for example, Vaidya Basti or other type of Lekhan Basti, so in the Snehan Svedana also we are using like oils like a Bruhat Saindavadi tail, cotton chukkadi oil, because this kind of oils are also having like a similar kind of a property. They are also helping us to scrape out and get rid of from this arm condition or detoxifying property. So these are the things that we are using in permutations and combination that we will discuss in the further action. So then again, when there is a bloating, when there is a excess accumulation of the flatulence or the bloating is there, so this is also very useful in that condition. Especially when the people are having the obesity, and due to the obesity when they are having the joint related problems, so we are also using the Lekhan Basti, and we are doing the Snehan Svedana with this Lekhan Basti. We are doing this combination of these therapies together. So again, in the Sneha Vapad, when we are having the Sneha Jitna or Sneha Vapad, also we are using this kind of condition. And as I already told you that in the obesity, when there is a rheumatoid or osteoarthritis conditions are there, also we are using this Lekhan Basti in that condition. So that you know that Adhishtan Veda, this is Pakvashagat Basti, that what we are using. Now here I just would like to share that there are in the our texts from Shushruta Samhita, from Vangasen, from the Ashtanga Hridaya, from Charak Samhita, that there are, you can see the various kinds of combinations and the permutation in the Lekhan Basti. The most important factor that what we need to see in this combination, what has been most commonly used, that is the first is the Makshikam. You know that the madhu madhu is also the one of the best scraping agent for our body, and that is helping also to get rid of from the fat and to get rid of from the obstruction in the system or shrota shodha. And then again the second important factor is that is saindav, that is the sodium chloride, that is helping us to give the balance to the electrolyte, and also which is having the good anulomana action. The Snehadravya is also important here. And then the second is Kalka. Kalka, what kind of Kalk we are using? Basically, if you look at the ingredient point of view, the Kalks are like, for example, Madanfal, Vacha, then also Ushakadi Ganam. But in Ushakadi Ganam, there are various kinds of herbal mineral preparations are there, and sometimes it's very difficult to utilize those, that kind of kalka. Then instead of that, we can use the Hingu Vachadi Churnam, which is easily available. So we can use this in the kalka form. So see again, what we need to see here, it is having again a penetrating property, which is helping also to eliminate the to do the detoxification means from the Basti point of view, enhance and boost the action of the ingredients what we are utilizing. Triphala Kashayam, that what we know everyone, that Triphala is very important as a Lekana property. So mostly Triphala Kashayam is used. The Dhanyamla also due to Amla Dharma and this kanji, which is also helping to eliminate the Vata Visheshan and Yavaksharam. So this is the way, this one formula which is there, but I'm just see the, if you go to the next formula, again the similar combinations are there, but only now the additionally here what we can see as a Gomutra. In the last preparation, if you go to the first preparation, there was Yavaksharam, which is being utilized for the penetration point of view. And here now Gomutra, which is also Ushna Tikshna and also Sukshma Surutogamitva. That's why Gomutra is being used. Rest of the ingredients that you will see, little bit quantity wise here, differences are there. Like in the last preparation, you have seen the Makshikam 200 gram. Here you will see the 160 gram. But only there is a difference of proportionate, but otherwise the ingredients are mostly same. Here now only additionally we have utilized Gomutra. We go to the third, Lekhan Basti. Again, the difference here is now instead of uh, Triphala Kashayam, here we have used the Erandamula Kashayam. Now, if you look at this Erandamula Kashayam, now some of the people they are having like a Kattashrit Vat. Okay, when there is a due to the obesity, people have got the accumulation of excessive fat around the hips joints, and there is a also pain in the lumbosacral region. So we can utilize such kind of Lekhan Basti in those patients. Then the Kshara Basti, just same similar combination. Only here the Gomutra is more in a quantity, that is a 400 ml. Then Vaitaran Basti, I just talked about in the beginning, because this is also one of my favorite Basti that what I am utilizing, especially in Kattashritvar, or especially in the when there is a Amavata condition is there. So joints are swollen, there is pain, and you see the normal the signs and symptoms, that shifting pain, joint inflammations, and the swelling around the different joints. So in those conditions, so this basti, which is having utkleshana property, so that helps to uh, create little utkleshana in a dosha, and then we can easily take them out. So that's why this is a very important basti that is helping to take out the this vitiated factor from the body. That's why, and you see the more important factor here, what has been used, that is amlika, that is chincha, is the kalka form, and gomutra. Gomutra again is a 200 ml. So this basti is again also of Lekhana type and also Utkleshana type. So in the basic reference has come from the Amavata condition, but again it is very useful in the conditions like where we can also use in this obesity and also arthritis related condition also. Now I will just go little briefly that what ingredients we have seen in this list of ingredients, what we have seen in the content of this last different preparations, like uh, these 4 or 5 types of the bastis what we have seen. The main ingredients what we have seen, that is a makshikam, then Saindavam, then Snehadravya, then Kalkadravya, then Kashaya, and Gomutra. So this is the main content of this Lekhan Basti, that what we can see. Now if you look at the Makshikam, Makshikam is nothing but it's a sucralose. Means this, that which is helping us again, which is from the Ayurvedic perspective, if you look at it, this is a yoga vahi, means that is, it is like a carrying, and also main guna of honey, that everyone knows that it is a scraping agent which is helping us to reduce the excess fat from the body, medohara, and also it takes the whatever ingredients you are taking in, so to get a proper paste, to get to create a great emulsion, this is also helping us to create a good emulsion, so that emulsion is getting penetrated to the sukshma surkasas very well, and also it is whatever is being stick into the system, into the srotasa, to take them out. This is one of the very good point. And also rukshana means it is scraping the fat from the body. Okay, the another most important ingredient what we have seen in the content, that is saindavam. Saindav, it is again that the salt, which is again Ushna in property, Anulomana, and whatever the ingredients we are taking, so it is taking to the particular system into the body, so that the Gamitva is to take whatever the ingredients are there for Medovas Protasa we want to reach. So it takes those ingredients to that level. Then the Snehadravya, which is one of the very important part. Most of the time, see here we are using the Pippaladi Anuvasana or Murchit Eranda Tailam. So these oils, which is having again a Deepana Pachana property, also again having the Anulomana property. So that's why the fecal matter or whatever the debris is there into the system, which can be easily evacuated and it can be taken out easily. Now, this is a very important part uh, in the Basti part, because the kalka, most of the time the kalka is used like Madanapal, Bilva, Kushtha, Vacha, Shatava, Musta, Pippali, And if you look at those ingredients, these ingredients again, they are Ushna Tikshna. Means whatever the combination we are doing into the basti, so whatever this homogeneous mixture we are creating to give introduced to the anorectal tract. So this homogeneous mixture which is containing this kind of a kalka, this prakshepa dravyas, this kalka is having the action to boost the action. These are like a booster. If you see this Shatava is there for example, then now this in the Vaitaran Basti what Amlika, I mean this tamarind paste what we are using. Again, these ingredients they are having the Ushna Tikshna property, which is also taking this Basti, which is easily absorbed. So this they are increasing the absorption of this Basti. That's why this Kalka is one of the very important factor in the Basti point of view. Now, if you look at the Kashai Dravyas, now mostly what we have seen that main Kashai Dravya that Triphala has been used. Then another Kashayam that what we have seen is that as the Eranda Kashayam, Eranda Mula Kashayam. If you look at this Kashayam, they themselves is having the Lekhana property. So they are also Vata Kapahara property is there and also reducing the Meda from the our system. On the other side, like when we are using the triphala, when there is a system, there is some kind of a blockage, constipation is there. So triphala is also helping to eliminate the whatever the excess fecal matter is getting accumulated. So it is also been thrown out. So whatever the vitiated doshas are accumulated in the system, they are also helping to eliminate for the elimination point of view. That's why this Triphala Kashayam is one of the very important ingredient. At the same time, this Erendamula is having again Anulomana property. It is the same kind of ingredient, so it can be utilized in this Lekhan Basti. Then other ingredients, what important that what also we are using in our daily routine practice, that is a Gomutra. In Panchagava practice, everybody knows that it has been very well utilized orally and with the different Ayurvedic ingredients. It has been utilized to enhance the action of the Ayurvedic herbs that what I have seen, especially in our this Vishwanand Kendra, we are also having a special Panchagava department where this Panchagava department people they are using this Panchagava products in combination with the Ayurvedic herbs. So what we have seen here, most of the people are getting benefit very well due to this kind of a Panchagava products, what is being in combination utilized with the herbs, they are getting enhanced action of our Ayurvedic herbs. So we have seen very well here this different kinds of cancerous patients that are being treated under our Panchagava department. And really, it's a really great help for our patients here because see, our center is an integrative medicine center. So we are different specialty practitioners. We are practicing here on this platform in an integrative way. So what is the best of all approach that we are approaching with that? What is being used from the every science? What is the best? So that which is utilizing for our patients here. So now Neurobasti, we everyone knows that it has been given on empty stomach. Now I would like to emphasize more on this topic also. When we are going to give the Lekhan Basti, we know that okay, what is the action is being expected, that is to reduce and to scrape out the fat or to get rid of from the excess body weight. Okay, now what we are doing here in our practice as a Purva Karma, so we are using all the Ushna Dravya oils as a snehan. First of all, so we are using Bruhat Saindavadi Tailam. Okay, Bruhat Saindavadi Tailam, which is not been commonly utilized. This is from the Vaishajya Ratnavali. Okay, if you look at this, the content of this oil, see the first content that is the Lavan, then the Rasna, and very important you can see there is a Dadimastu, and all other Ushna Tikshna Dravyas are being used. See, basically if you look into the Falashruti, it is being utilized also in Amata cases, then all these rheumatic cases, but the content are very scraping. Means they are helping to scrape out the excess fat from the body. Means they are also having the Vata Shamana. There is also like Rasna is there, Shatava is there. Then the Trikatu is there, Triphala is there. Means this kind of ingredients they are also helping to scrape out the excess fat. Means see, Snehan is one of the part and parcel of our karma. So the oil is also helping to enhance the action of our treatment. So that's why Saindavadi tail, which is very commonly we are using in our protocol. Then the second other oils are also we are utilizing, that is the Panchamla Tailam, then Cotton Chukkadi Tailam. See, these are the South Indian traditional oils which we are not using here in Maharashtra very commonly, but now they are easily widely available also here in our practice. So also we are integrating those oils because the main factor is that we want the Ushna Tailam. So the Ushna is having this scraping agent property. So that's why when we are expecting this Medohara action, so for that matter, we require a Ushna Tikshna oil. So that's why we are using this kind of a combination like Broth Saindavadi Tailam, Kottan Chukkadi Tailam, Panchamta Tailam from the external point of view. Now this is the first line of action that Snehan has been done. Now, the second thing that what we are doing, that is a Udvartana. Udvartana is a very important point of view when we are treating the obese patient. Like see, generally when we think Udvartana is especially, it has not been commonly practiced here in our part. But if you see the Kerala tradition, they are using this treatment as a Pachana treatment. In our Ayurvedic tradition, we say that okay, first the Pachana has to be done, and then the other Shamana treatment has been done in the further. So this Udvartana treatment is like also Pachana treatment in the beginning. So that's why this can be utilized as a Udvartana as a Pachana treatment. In Udvartana, what we are using in our practice here, it is a Kolakulattadi Churna. If you look at the Kolakulattadi Churna, Kol, Kulatha, then Devadaru, Rasna, Erandam, this and these kind of ingredients which are again having the scraping agent property. Or like a Medohara Lekhan Churna, also that we can utilize here as a Udvartana Churna. Ultimately, what is happening with this? So Udvartanam Kapha Medoharam means when we are doing whatever the kapha accumulation is there, there is avrutatva of kapha or vata is there. So this kind of a Udvartana treatment when we are, it is like a scrubbing treatment. So whatever the subcutaneous fat or cellulite is there, it is helping to reduce that, and that's why again it is helping to give the inch loss to the patient. This is also what we have seen our patients when we see the some case studies also. Then Sarvanga Svedana, that we are giving the Sarvanga Svedana with the Devdar and the Shmula Kashayam. This is what we are using as a Purva Karma in our Lekhan Basti. Now Pradhan Karma, everyone knows that now we are giving it with the this mixture. See, very important part now when we are giving this Lekhan Basti at that time, when if you are giving it with the enema can, so it doesn't go properly. To keep in mind that what happens, because see there are different combinations are there here. Now there is a kashayam, there is a oil, there is a kalka. So if this mixture is not properly mixed together, then what happens? The oil is coming on the top, then the only kashayam and sendam and the kalka goes down, it precipitates, and only the middle kashayam is going inside. So first of all, there should be a proper rotator inside so that the mixture, homogeneous mixture, should go and get penetrated very well through the anus so that whatever the action you are expecting, that you will get in the correct way. That's why this is a very important factor whenever we, like if you see that in Kerala tradition, that they are giving with the Basti Netra and so that's with the Basti pouch. So it goes, this is a very homogeneous mixture, and that is they are introducing to the NS in a very quick way. So the homogeneous mixture goes inside with the very good force, and it gives the expected action. Only it is a very problematic when you give with the enema can. So we need to take care. We need to put a rotator inside and give a little bit of pressure so that the homogeneous mixture can go inside the anorectal tract in a very well way. Okay. Now, Paschat Karma, everybody knows that. So in the Paschat Karma, that what we are expecting, that the Basti should come out in a proper way. Uh, and after that, what has to be done is good rest, then the adequate diet, and next day is Anuvasam Basti. So this is what briefly just I wanted to define the line of action what we are giving in our Lekhan Basti cases. So I would like to give you some of the case presentation with you so that we can whatever we have discussed just as a line of action in the obesity patient, that what we are doing as a Snehana, Udvartana, then the Basti treatment, and what result we are getting. So, see, I have just, we know the common complaints of the obesity patient here, that, okay, overweight, then the excessive hunger, thirst, sweating, bad odor due to the sweating, then the tiredness, snoring, lethargy, then whenever they are doing the work, there is no, they are getting slow down in their actions. So these are the main signs and symptoms that what we can see in these patients very well. Now those patients what I have treated here, and what other common factors that is also been seen here, like some of the patient they were having a hypothyroid, some of the patient they were having hypertension also. So that kind of cases also we have taken in this Basti treatment. So when patient are coming for this Basti treatment, we give the a dietary regime also. So what we do, like we are giving them the that everybody knows that because ahara is like a aushadha pathyam. So this pathyam is one of the main treatment that we give it to the patient. And it's first we keep the patient on the mixture of our Ayurvedic diet in this way, that we keep it the patient on the Sansarjana Krama and like a fruit plate. So the fruit diet, and like for example, like a rice kanji, for example, or moong khichdi, such kind of a mixture with the fruit and this uh, very light meal that we are giving it to the patient, so that he should have just one small fruit plate in the morning, in the evening, so that whatever the micronourishment is required, that he is getting through that. And in the lunch and dinner, we are providing some kind of a soup, and also we are allowing them to eat the mung bean soup, for example, mudgayusham, odanam. Such kind of things we are allowing them to drink for the lunch and dinner. So this is the way how we provide the diet, and we give them the dietary sheet, like, and so they are following it accordingly. What Okay, the lifestyle changes means that there should not be daytime sleeping, no excessive drinking of water, especially after the meal. So these kind of tips are very important, which are causing the obesity. These kind of things we are advising to the patients. As I already explained, the Udvartana treatment, which is also main line of action in this treatment, and also medicines that what we are giving, Varanadi Kashayam, which is again a special kashayam from the Kerala tradition, that what we are using in this obesity cases. Okay, now I will just share some cases that what we have treated here. See, this was the one lady who was having the weight around 85.2 kg. Now I will tell you this protocol what we are following here. This is the 8 days treatment patient is undergoing. First day, again, the snehana for the full body, that is with the Braj Sangavadi Tailam. Then Udvartanam with the Kola Kulattadi Churnam. Then the full body is Tarvanga Svedanam with Devdar and Dashmul Kashayam. And the fourth important factor, that is the Basti. On the first day we give Palladi Anuvasan Basti, and next day we give the Niruva Basti of Lekhan Basti with Trifala and Gomutra. That what we have seen in the this what we have seen different 5 types of the Lekhan Basti. That second type of Lekhan Basti with Trifala Gomutra, that what we are utilizing it for the patient. So this is the sequence that what we follow for 8 days. The diet is being also given for the 8 days, and this is the result that what you can see here. The lady, oh, she was weighing 80.5 kg. It came down to 84.3. Then the chest circumference, which was 44, which came down to 43.5. Abdominal girth, which was 50, it came down to 45. Waist circumference 50.5, which came down to 49. Arms 17.5 and came down to 16 centimeter. So this is the again the thigh, which was 25 centimeter, which came down to 24 centimeter. So 1 centimeter loss that we can see here, and also 1.5 kg weight loss also we can see here within these 8 days in this case. Now this is the second case. Again, those cases were what we have seen here. They were having also a problem with the hypothyroid. At the same time, some patients they were having also the hypertension. And so this is the diet that what we are following as a most commonly, but we also do consider the prakriti of the patient. So whenever there are permutations and combination, we are so it should become like a personalized program for them when we introduce. Because sometime also, like when we are using cotton chukkali thailam, some of the patients they get the reaction. So we are changing those kind of oils also for such patients. This is very commonly seen here that when we are using this cotton chukkali thailam, in some patients we are getting the reactions on their skin. So then we are changing some of the oils in that condition. So again here the second case, now she was weighing 79 kg, she came down to 78. Chest circumference from 40 it came down to 38. Abdominal girth it came down 38 36.5 to 30.5.8, and arm 12.6 to 12.2, and thigh 30 29.5. Little bit difference is there, not so big difference, 1 kg weight difference, and in the circumferences we can see some half a centimeter, 1 centimeter differences. Some of the patient when they undergo this treatment, the again the time factor is also very important. What we have seen when these people they receive this kind of treatment, especially in the Grishma Rutu, in the summer season, and especially in the rainy season, they can lose weight very easily. We have seen that those people who are receiving this treatment, especially in the winter time, it's very difficult to lose the weight. At least we can see the inch loss and laghava. Means they can feel that okay, there is a feeling of lightness, but on weighing scale you will not see any change. That's why very important factor, first we need to convince them okay, there will be no change when you are receiving the treatment in the winter season on the scale, but you will see the feeling of lightness and some inch loss will be there. This kind of a thing has to be explained to the patient. That's why I've just showed this case over here. Next case, this was a very interesting case. 67.1, which has reduced to 66 kg. Chest circumference, it came down 38.5 to 36 inches. 34 abdominal girth, which reduced to 33, and arm 12.5 to 12, and thigh from 22 to 21. So this was the case we just recently treated in this summer season. That's why we can see that there is a 2 kg weight loss and also inch loss in a good amount. this happened due to the season. That's why I just shared this case also here. That's why the seasonal change is also plays a very big important role in our panchakarma therapies. That's why it is very important for us to understand that when you are going to do the treatment and what kind of a result you are going to expect, so that otherwise what happens, especially with this obese patient, when you are treating and if they don't see the result, they are getting frustrated because all the time they are trying so many different things. So that's why first we need to convince them for this kind of a result in this way, so that they will not get frustrated. Okay, so this is all about what I wanted to share from the Lekhan Basti point of view. I just to summarize here that the Lekhan from the external and from the internal point of view. So that gives the cumulative effect in this way. This is just that's why I shared these three different cases over here. Now recently, just this topic of Basti is there. That's why I just wanted to share one more case which is not related to this topic, but uh, there is one nephrotic syndrome case which I was treating, and now the he was a young boy when he came for the treatment. He was just 8 year old who came in 2008, and now he just recently visited me. Now he has become a BMS doctor. That's why I'm just sharing this case. Uh, this patient, when he came to me, he was having protein loss. This is a nephrotic syndrome case, and he was having a tendency to become sick frequently. So commonly, rhinitis, cold, and cough, and all the time he used to sick, and he needs to take a leave from the school. So parents were very much worried, and so he was on a steroid, 20 milligram steroid, and then which was reduced to 10 milligrams. So this was the his clinical history. He got diagnosed at the 3.5 year when he was 3.5 year old, and so then he had been to various modern medicine doctors. Even in he was basically he was from the Lasalgaon, from the Nashik district, but he was coming here for the treatment to Dr. Anand Pandit from the KM hospital here. Yeah, and he was on Visalon. So this was his when he was having all these kind of symptoms. So they had been to various nephrologists, pediatric physicians. So you can see his some of the reports and his discharge card, that you can see that it's been mentioned here. He was suffering from the nephrotic syndrome. Okay, this was the case. He was having, you can see that in the urine there was a protein loss of 4 plus. So we started the treatment then in 2008 with Bruhatyadi Kashayam, Amvatari Kashayam orally, Chandraprabha, Shradharana Churnam. And the important thing that in this case, because he was from the far distance, then I taught his mother to give the basti. Sukumar Girtam and Vastamanta Girtan has been used because just 10 ml I have used as Anvasan Basti, and Nuruha Basti I used the Bruhatyadi Kashayam. So this treatment was done like a Karma Basti, that was means 30 days. I told to do this treatment continuously for 1 month. So this after 1 month, see the result. The edema got reduced, protein in the urine came down to 1 plus, and the feeling of wellness means that the child was becoming very sick frequently, so that has come down. So same medicines were then continued. Then again the basti was repeated. Again the same medicines continued, and at the end of 2009, so this protein was nil in the urine. So this is the way when we continued this Basti treatment again. So I told them to repeat it after 3 months, again for the 6 months, then once in a year. So like this way, like even for the preventive point of view, also this I continued this Basti treatment for once in a year, for example. So then this was then the result that you can see that the protein was nil absent in this last report. So this is the way that how the Basti can also help in. Now this boy, why I just shared because yes, today's topic was Basti, and just now this boy has become a BMS doctor recently. He passed out his last year, and I'm so very happy now. He's completely symptom free. He's not having any kind of signs and symptom from this nephrotic syndrome. That's really greatness of this Basti treatment. What uh, I have seen, I have treated so many. Then later, such kind of a nephrotic syndrome cases, and really, this Basti is one of the wonderful treatment which is also helping to get rid of from this protein issues what the people are suffering from. So, thank you very much for this small clinical presentation. And so, if anybody is having any kind of questions, you are really welcome for this.
Thank you so much. It was amazing presentation with lot of information and clinical experience. Uh, yeah, I would love to know if anybody has any questions.
Uh, can you please explain about the diet which you are giving? About fruit diet, especially. It's a seasonal one,
Okay.
or
So basically, we are keeping this patient on the fruit diet and our Sansarjan Kram diet. In the Sansarjan Kram, that what we are using like Mudgayush and Odanam, for example. So this kind of a thing that what we are as a warm meal because Ushnam Chashnyat. So we are providing them this warm meal like in the form of like warm khichdi, then the warm mudgayusham, then the our this uh, rice kanji. So these kind of things that what we are advising them to take during this meal, and also in the morning time for the as a breakfast, we just advise to take a fruit plate so that whatever the micro nourishment is required, that we are giving it, providing it from the fruit point of view. And again, the same way we are also advising because sometimes these people they keep eating frequently. They are having the craving for the food especially, and so then what we are advising, okay, whenever they feel hungry, okay, pick up the fruit and just eat it when they are hungry. So this is what advice we are giving it during that our therapy.
thank you.
Right, right. Oh, that's wonderful. So it's really very structured, exactly what to eat and when to eat. That's amazing. So I have a question actually. It's regarding the Pitta Pradhan Prakriti or if there is a Pitta Prakop. Because most of these herbs or all the kashayas and everything that we are doing for Pachana or everything is like more Ushna. So how do you make changes based off of the Pitta Pradhanya?
Yeah, that's why there we make the difference in between, like then the difficulty in utilizing this kind of a gomutra, then the also this other kalkadravas especially.
Mm-hmm.
So there we make a big change in that. For example, when the patient is coming with the pitta prakruti, then we are using the trifala decoction. Then we are not using the gomutra in that case. Okay. Then we are not utilizing this the kalkas that which are having the ushna property. We are just adding some badana phala which is not too much causing the any irritative effect into the intestinal mucosa. So very or like a bilwa or kushta. So very few ingredients that we are adding so that these people which is having the pitta prakriti, they are not getting irritated with this kind of acidity. And also even for the external therapies, the selection of oil is again different over here. So like for example, then we don't use the cotton chukkadi tailam. So then we are using the other oils like a panchamla tailam or a ketaki muladi tailam. So which are little bit warm but not causing the any kind of irritation to the skin for such a sensitive person.
Right, right, right. Yeah, that's amazing.
Yeah, for Udvartana also we make a difference, because then those people who are very sensitive, then we are having a one, we call it as like a Shahi Utna.
Hmm.
So in that case, then we are mixing it with this Kola Kulattadi. In the Shahi Utna, we are having this, we are using the almonds powder, Badamgiri Magaj, that we
Hmm.
are using in that, which is a bit little unctuous also, which is not creating irritation. Then we are using also Kachora, means a little bit to reduce the irritative action or the scraping action what this Kolakulattadi churna is having. So we are adding additionally in this so that we should get the scraping agent effect, but there should not be irritation to the skin. So we are making this combination. We are also adding some rose petals into this so that all these other ingredients are also giving the balance to that.
Okay, okay. Absolutely. Yeah, sounds great. Thank you so much for explaining that. The other thing I wanted to know a little bit about Shot. So, if there is Ekanga Shot or Sarvanga Shot, have you seen any results, with these busties?
Yeah, especially then we use when there are shows and this thing are there, then we are using this Vaitaran Basti.
Mm.
Whenever because that is again Shodhana and a Lekhana, which is also doing Utkleshana, and so whatever the accumulation of this doshas or ama condition is there, to check out all those Shrotoroda and to eliminate this Shotha, these are the things that is helping in this condition. So we are using the Vaitaran Basti in those conditions.
Okay, okay. And are you giving any internal medication for Deepan Pachan along with that, or mostly using Basti
Yeah,
only?
see, the very good question, because without that, first of all, we do the Pachana treatment. So our most common and main using drug is that Shadharan. Shadharan is the main Amapachana medicine that what we are using in these patients. And whenever the therapy is going on, we also keep the patient on the Shadharan tablet.
Okay, okay.
So
Excellent.
that sometimes patients they may not follow our dietary regime properly, so
Mm.
then maybe sometimes there are chances to get some indigestion, so that it is better to keep them under control of the medicine, so that because sometimes then when we are doing this shodhana treatments, at that time if there is indigestive symptoms are, then again then it's very difficult to carry out the procedure further. That's why we keep them on shardhara.
Okay, okay. Excellent. Thank you so
And
much.
I, and I think so psychology of the patient is also we should give
Yeah.
them something internal medicine.
Yes. No, that we do. We are utilizing this Varanadi Kashayam tablet, Shadharan Churna, miss all these things. Mainly if you look at the Varanadi Kashayam from this Kerala tradition, it is
Mm.
mainly for the Kapha Medohara. So that's why it is also helping to scrape out the excess fat from the body, helping to weight loss, and at the same time, Shadharan is taking care for the digestion. So in the both way, the metabolism is maintained very actively, and so that is giving the cumulative effect for the weight loss.
Right, right, right. Excellent. Yeah, all these preparations are really wonderful.
Thank you.
Okay. Anybody has any questions?
Hello.
Hello.
Good evening, sir. I have a question
Yes,
regarding
please.
Udvartvan. You mentioned about the powder. Sorry, I missed the name of the powder. I just wanted to know the name of the powder.
Okay, we are using the Kola Kulattadi Churna.
Kolo kulatadi churna.
Yeah. So Kola Kulattadi Churna is basically Kol Kulatta, then Devdar, and Rasna and Eranda, which is having this Lekhana property. So they are helping to scrape out the subcutaneous fat. So that's why we are using this Kola Kulattadi Churna. So that is helping for the inch loss basically.
Okay, sir. Also, I wanted to know, as I am based in Philippines, so recently I am thinking of starting Panchakarma treatment over here. So this is the first time who is introducing Panchakarma therapy in Philippines. So I was like, if I wanted to do Udvartan, so there are like medical medicine restrictions for me. So for
Right.
Udvartan, what can I use?
So see, basically what is meant by Udvartan, you need a very coarse powder.
Yeah.
Okay. If you get a Triphala powder, this can be utilized. Otherwise, any kind of a powder which is having a scrubbing action. Okay.
Okay.
It should not be a fine powder. It should be a coarse powder. For example, now you see in this, what do we call this, walnut scrub. What is been
Yeah.
used over there? The walnut bark. The this is which is made into the coarse fine powder. It is not totally fine, but there are particles. So this is the action of those particles also. See here in Kolkulattadi Churna, they are having the action which is they are warm in nature. So we have to think from that point of view what I can utilize as a warm that you can get in Philippines.
Okay. Yeah, because here I'm having challenges for the medicines
Yeah,
because
that I can
everybody,
understand. So
yeah.
that's why I said you need to see that which is a little Ushna Dikshna, but which will not cause the any irritation to the skin.
Yes,
Okay,
yes,
Ushna
absolutely.
Dikshna, but it should not cause irritation to the skin, which is having a good scraping property. For example, like this, how the people are utilizing this walnut scrub. Same kind of a powder that can be utilized to scrub the skin.
Okay, so apart from that, if we use like the koras powder, along with that, we can add like the masoor dal like powder and all. We can
Yeah, definitely. See, this is very
add.
again important. If you need to make a coarse powder of it, and if you apply that, even the now you said that, for example, the mung bean scheme, hmm?
Yeah,
Okay, mung, and the skin of that, which is again a drying property. And if you make a coarse powder of it, and if you apply it, again that is going to help you to as like a scrub.
yeah. Okay, okay.
Very
Thank you so
nice,
much,
good
sir.
option for you.
Yeah, yeah. Because I was looking for a basic like whatever I have to use here, like simple remedies.
Yeah, I know because see, I'm working in Europe, so I know the limitation of the medicines over there.
Yeah.
So you need to find out what is locally available. Already, Charakacharya has says what is growing beside you. You have to find it the solutions from that. So better
Yes.
you look for the local solution, so that will make your practice more easy.
Yeah, yeah. Thank you so much, sir. Thanks for the
Yeah, great.
replying
Thank you.
my query. Thank you so much.
Yeah,
Welcome.
that's a great insight for everybody who is practicing away from India, because there is always a challenge with getting various herbs and supplements, and you have to look for and be more creative and try to work on the gunas, like look at the qualities that you are looking for, and then accordingly, whatever you find in your area, you need to use those things. That was a great question and really nice insight, Vaidya Mandlecha ji. Okay. All right. Thank you so much. Thank you, everybody, for being here and attending this webinar. Thank you so much, Ajit Mandela ji, for wonderful, informative session. It was very,
Thank
very
you very much.
helpful to all of us, all the listeners. And this recording will be on our YouTube channel. So you can definitely go back and you can listen to that again and again. And please watch and subscribe to our YouTube channel to view the earlier webinars and other presentations as well. So basically, we have one webinar every month, and most probably I will reach out to Vaidya Ajit ji again for another beautiful workshop.
Definitely.
This kind of
About
webinar.
about Potali, he is very expert
Okay.
in that.
Right,
Yes,
right.
sir. Thank you very much, sir.
Yeah. Thank you so much, everybody. Yeah.
Yeah, thank you, ma'am. Thank you, sir. Thank you for this opportunity.
It's my
Ayurveda
pleasure.
organization.
My pleasure and Asawari's pleasure also. To having such great stalwarts from all over Maharashtra.
Absolutely. I'm so glad that the work that you have been doing so many years is getting into the limelight and it's being helpful for everybody. All right. Thank you.
Yes. Thank
Good
you.
night,
Thank you very
everybody.
much.
If anybody has any questions, please contact us at Ayurveda Research USA at gmail.com. You can also email me at asavari@mnayurveda.com. Thank you.
Thank you,
Thank you.
ma'am. Thank you, sir, for the wonderful lecture.
Thank you. Thank you.
Very well explained. Again.
Thank you, sir.